Bun găsit! Traversăm o perioadă neobișnuită, cu multe incertitudini în ceea ce privește starea sănătății noastre. Pandemia de coronavirus ne-a acaparat atenția. În fiecare zi vorbim și auzim vorbindu-se despre acest subiect, ceea ce este bine într-o anumită măsură, pentru că trebuie să fim informați. Pe de altă parte, nu trebuie să ne scape din atenție celelalte boli care fac mii de victime anual. Cancerul, de exemplu, este una dintre acestea. 140 de români mor zilnic din cauza diagnosticării în stadii avansate a bolii. Cel puțin asta arată statisticile pe 2019. Așadar, bolnavii apelează atât la medici din țară, dar și la specialiști din afara țării. Austria este de câțiva ani una dintre principalele destinații medicale pentru români. Tocmai de aceea, astăzi stau de vorbă cu profesor Doctor Johannes Drach, specialist oncolog în cadrul rețelei private austriece PremiQaMed. Hello, I'm glad that we are talking about this important topic today. Why do you think Romanians choose Austria to treat cancer or for a second opinion?
Yeah. Hello, it's a good time to address these questions because we get a lot of requests in this regard. And in my opinion, there are several reasons why this is the case. In particular, in the field of diagnosis and treatment of cancer, we can offer a very interdisciplinary approach. This is very important in cancer diagnosis and treatment, that the major disciplines work together. So very close collaboration between the disciplines of surgery, of medical oncology, radiotherapy, and also diagnostics. And sometimes it's important to engage specialized pathologists. And the close collaboration is the key to an individualized diagnosis and treatment. There is a second issue that is important. In Austria, we are in the fortunate position that we have usually a very early access to modern treatment approaches, including novel agents and novel treatment medications. And this together with the interaction of specialists and the possibility to treat with modern medications and approaches, this brings us in a very good position to have very good outcomes in many cancer diagnoses.
As a specialist oncology, you have seen many cancer patients coming from Romania. Could you say what diseases are most common?
We get a lot of patients and contacts, but the pattern of contacts clearly reflects what are the major diagnoses in the field of cancer. So we know that cancers of the gastrointestinal tract, including stomach, colon, and pancreas, they are very frequent contacts, but also other frequent diseases like breast cancer and lung cancers, and also lymphomas. These are very common contacts.
Professor, you have a very extensive experience in medicine and oncology. What developments have there been in this area in recent years?
Very important developments include number one, advances in the diagnostic approaches. This is new techniques and also new pathologic techniques to clearly define the disease that is present in an individual patient. This has been improved a lot during the past years, and we can now come up with a very specific diagnosis in an individual case. Number two, this has translated into an individualized treatment approach in many patients, so that we do not just treat lymphoma or breast cancer, for example, but we can treat the very specific disease in an individual patient. It is a kind of personalized medicine that we know exactly about the disease and the molecular features of the disease, and we can design an optimized treatment for the individual patients. And number 3, it is the development in the field of medical oncology that has brought forward many new medications, now medications that are not classical chemotherapy, but very targeted treatments. That we can use medications that specifically target cancer cells very effectively. And on the other hand, the tolerability of the treatment gets much better because the normal cells in the body, the normal tissue, is not so much affected compared to previous treatment approaches. And this also includes the recent developments in the field of immunotherapy, very specific antibodies that are part of immunotherapy, but also other new approaches. Currently, some experimental approaches, but the potential is great that these new approaches will further enhance our ability to give effective treatment to very difficult diseases.
Do you have any advice for patients during or after cancer therapy, maybe about food or lifestyle, sports?
This is an important issue because many patients ask for that. What can I do by myself on top of the recommended treatment, medical treatment, surgery, and so on? And indeed, it is important to take care of an active lifestyle, to be physically active, because we know that tolerability of treatment is much better when you are physically active, when you do some regular activity. It will help you to overcome a frequent problem that we call fatigue syndrome. It is the phenomenon that many patients experience tiredness and inability to move, or it's very hard for them to move, to get going. And only with activity and trying to maintain an active lifestyle, you can really overcome this major problem. We also know that an active lifestyle is important after treatment because there's many data available that being physically active, maintaining a healthy lifestyle, it contributes to the fact that relapse rates are much lower in active people compared to those that do no physical activity. So there are good reasons to do that. Regarding nutrition, it is a frequently asked question because there are many, I would say, many rumors, but there are many unproven theories what may be good or bad in the context of cancer treatment. My advice, and also the scientific basis for that, is that patients should use a nutrition plan that is characterized by a low amount of sugar. This is a well-established criterion. Otherwise, it is really recommended to use a balanced nutrition plan with sufficient amounts of all important elements, of proteins, of carbohydrates, and also use fruits and vegetables as the important source for vitamins and microelements, because they are present in a balanced feature in these nutrients, and the body is able to use them in a favorable way.
As we were talking in the beginning, Romanians choose Austria as the medical destination for already a few years now. Is there any case in particular coming from Romania that you remember well?
Yeah, I can present a case that is very present in my memory. When I was contacted from a patient with really bad general condition and massive pain, specifically bone pain, because of a diagnosis of multiple myeloma. This is a cancer of the bone marrow and presents usually with manifestations in the skeleton, with manifestations in the bone, leading to bone pain and also leading to fatigue and tiredness because of low numbers of red blood cells. And this patient really presented in poor general condition and massive bone pain. So the diagnosis was established and rapidly treated. And due to modern medication, and then also a treatment that is called autologous stem cell transplantation, this patient could achieve a complete remission, so a complete resolution of all findings, and thereby leading to a complete resolution of the bone pain. And now the patient lives a normal life, and he has been in complete remission for more than 3 years, which is really a very good example of what we can achieve and bring back quality of life to the patient.
I have one last question. Do you also offer the possibility of remote consultation, video consultation?
Yes, this is a possibility, not only the personal consultation, but also the remote consultation, which is very important during the current problem with traveling and the travel restrictions. So we can offer remote consultation and reviewing of findings and giving treatment recommendations via this technique.
Okay, these were my questions. Professor, thank you very much.
Thank you.
Înainte să-mi iau la revedere, aș vrea să adaug și faptul că găsiți detalii despre cum puteți contacta echipa de specialiști în oncologia PremiQaMed în articolul care va fi publicat în curând pe site-urile Adevarul și click.ro. Important de specificat și că echipa de contact răspunde în limba română oricărei solicitări.